We all have increasing demands on our time today, and we're all asked to do more and more in less and less time. And as we talked about earlier, the literature is growing exponentially. Pathologists who are just beginning their careers are well aware of how important it is to keep current in the literature. And we believe that PathNet will give them a very viable, very cost-effective, and time-efficient way to do this. We live in an electronic age. Those of us who are a little older have come to this age a little slower than some of our younger colleagues. But I think those of us who have been in practice for a while have come to recognize that the electronic version of journals, the electronic means of keeping up to date with pathology is really the wave of the future. And as much as we like to carry around a hard copy version of a journal, ultimately I think we're all going to come to recognize that the electronic version of the journal is going to be easier to use. Well, we want to set up PathNet so that it specifically targets practicing pathologists. We'll not only have you have full access to journals online, complete with all the illustrations, but we'll also guide you to help pick the topics which we think are the most significant and give you some commentary on those topics, some items to think about with regard to the particular articles that are present. Pathology Network is designed to be a time and cost-saving tool to make it as easy as possible for all of us to stay up with the pathology literature. Path Network allows you to set up your own customized page, if you will, a home page for your pathology knowledge base. You can set up channels to have articles from a particular area of interest funneled directly to you. And we have a large number of predetermined channels basically by organ system so that one can, for instance, look at all the articles in breast pathology or GYN pathology. And then there are sub-channels for particular organs such as uterus or fallopian tube. I may well set up some customized channels for head and neck pathology, bone and soft tissue pathology, but in general I plan on using all of the channels as best I can to stay up with the literature. There's really nothing out there like PathNet. We can all go to Google or go to PubMed and we can get a download of abstracts or article titles, but then we don't have full access to the article, we don't have access to the illustrations. With PathNet you get instant online access to the entire article by category, by subject. You get to see all of the figures in the article. There's really, as I said, nothing like this out there at the moment. The crux of Path Network is that you can focus on what matters most to you.